Hello and welcome to the second part of our guide to interpreting CEESAT reliability criteria for use in CEEDER, the CE database of evidence reviews. My name is Andrew Pullin and I am presenting this series of short videos. In part 2, I will be looking at interpreting the first two criteria concerning the review question and the review protocol. The first CEESAT criterion is, are the elements of the review question clear? A well-defined question is crucial for assessing the reliability of subsequent decisions on searching and screening for eligible studies, as well as forming the basis for critical appraisal of primary study validity and for data extraction and synthesis. The question also has to be clear in order for you to make sense of the findings, of course. This is a fundamental criterion, therefore, that is really about transparency of objectives. Greater transparency and therefore reliability are provided if the question elements, such as the subject of interest and the cause and effect, are individually defined. So for this criterion, a gold rating indicates that the question is clearly stated and all the elements are clearly defined, whilst green indicates that the elements are inferable but not so formally defined. At this level, you should be able to assess whether the question is relevant to your needs. An amber rating indicates that the question is broadly stated but the elements are poorly defined or not defined at all, so that the reader has to make some important assumptions. It's important to note here that if the question is not stated at all and the rating for this criterion is therefore red, the article is excluded from the database. So you won't normally see a red rating for criterion 1.1 in the database. For criterion 2.1, we ask, is there an a priori protocol available for the review? Presence of such an a priori protocol enables you to assess to what extent authors may have changed their approach during the conduct of the review, behavior sometimes referred to as mission creep. Lack of an a priori protocol can mask ad hoc changes in conduct that may introduce bias. For example, this may be change in the study eligibility criteria, change in the data extraction method, or choice of approach to data synthesis. Independent peer review of protocols is also valuable in developing the methodology for a review, and stakeholder engagement at this stage can help ensure that the question is appropriate and unbiased. So for this criterion, a gold rating indicates that the authors provided a protocol that was independently peer-reviewed and made publicly accessible before the conduct of the review. The green rating indicates that an a priori protocol was made publicly accessible before the conduct of the review, but lacks independent peer review or verification. A rating of amber indicates that review reliability is compromised either because the protocol is lacking or has some deficiency, though the methods may be adequately described in the review itself. A red rating indicates that there is no protocol and the reported methods are not sufficiently described so as to allow repetition. Unfortunately, the latter is a very common occurrence and makes many review findings less reliable than they could be simply with better reporting methods. Thanks for listening to this presentation. I hope it was helpful for giving you insights into the importance of a well-defined question and a well-developed protocol for increasing reliability of review findings to inform your decision making. If you have any questions or feedback, please use this email or visit the CEEDER website.